yesterday. I know I want to say that I want to say thank you to our TAC delegation for being here, all of their technical advisors, and a special thank you to our CDC federal partners. It was a wonderful first day of meeting, and I know that today will be much the same, and just happy to announce Dr. Dolphin made it here safe and sound. So welcome, Dr. Dolphin. Thank you.
Thank you, Deputy Chief.
Yes. So before we get started, we want to start this in the proper way. So I'm going to ask Second Chief Del Beaver to lead us in a blessing.
All right, Widow Chief, if you pray, I'd ask that you just pray with me. So let's bow our heads and close our eyes and let's pray. Dear Heavenly Father, Lord, I thank you for such a beautiful day. I thank you, Lord, for allowing us just to wake up, Lord, and just to do your will today. And so, Lord, I just ask that you be with our actions, you be with our thoughts, and you be with our words, Lord, today, and that you just guide and direct us throughout this day and just keep us safe. And Lord, as we prepare to go home today, I ask that you just give us safe travels, Lord. And Lord, I just ask you to look after our families as we're away from them, Lord. Look over our households, Lord, and Lord, just protect them, Lord. And Lord, again, I just thank you so much, Lord, for just giving us one more day to serve you, Lord. But Lord, I just ask all these things in your Son's precious and holy name. Amen.
Amen. Thank you, sir. Well, we've got a full slate of items today, but again, just very appreciative of everyone's time and attention on these matters. And so we'll get started here. Prior to getting this meeting started, I'd like to request that everyone attending in person, please silence their phones. We really want to be respectful to those presenting today. For everyone's awareness, this meeting is being recorded. I will now turn the meeting over to the Director of OTASA, Captain Kilsback, for a welcome and to initiate the roll call. Captain, you have the floor, sir.
Thank you. Good morning. Welcome back to the second day of the TAC meeting. We have a captivating agenda prepared for you, featuring insightful presentations from subject matter experts across CDC. Their expertise will cover a range of topics that directly align with the priorities we've heard from you, our TAC members. As a reminder, we have asked our presenters to allocate sufficient time for dialogue and discussion to ensure we hear from the TAC. Your insights and perspectives are invaluable, and we encourage active participation throughout the day's sessions. Thank you for your presence and active participation. We look forward to a day filled with engaging discussions and the invaluable contributions you bring to the table. I'm going to initiate roll call for record-keeping purposes. When I call your respective area or name, please respond with present. Alaska, Chief Alicia Andrew. Albuquerque, Councilman Conrad Jacket. Bemidji area, Deborah Danforth.
Present.
California area, Councilmember Teresa Sanchez.
Present.
Great Plains area, Geraldine Church.
Megan O'Connell, proxy for Miss Church.
Navajo area, Kim Russell.
Present.
Oklahoma area, Deputy Principal Chief Warner.
Present.
Tucson area, Councilwoman Garcia. National Large.
Alternate Vivian Saunders, Tucson area.
Thank you. National Large Member, Dr. Sharon Stanfield.
Present.
National Large Tribal Member, Legislature Connie Barker.
Present.
National Large Tribal Member, Councilwoman Hermina Frias.
Present.
National Large Tribal Member, Second Chief Del Beaver.
Present.
National Large Member, Councilwoman Carrie Freeman. Okay. We have quorum. I'll turn the meeting over to Deputy Principal Chief Warner. Thank you.
Outstanding. Thank you, Captain Kilsback. And at this time, I would like to welcome Dr. Dolphin to provide an update on the CDC's 1803 Tribal Capacity Cooperative Agreement Report and anything else that she sees fit.
Thank you, Deputy Chief Warner, and good morning, everyone. I am really delighted to be here in person, and sorry I couldn't be here in person yesterday. I know that the meeting has been going extremely well and just appreciate everyone's engagement and input. One of the things that I'd like to share about our tribal cooperative agreement is that we are now at a point where we are about to send out a request for centers, institutes, and offices across the agency to invest in projects. So this is a really good time where we do a call for support that will be going out soon. The updates that I have are that 32%, that's 8 out of the 25 recipients, are working towards closing out the 5-year cooperative agreement. The remaining 17 recipients, that's 68%, are working towards completing their approved activities through no-cost extension periods now and 2025. The Public Health Infrastructure Center's Division of Jurisdictional Support is leading a project and manuscript development about the administrative efficiencies and effectiveness realized for the agency through the use of this funding mechanism. The team working on this project is currently drafting an approach for this project and plan to have a draft report that we can share with you for awareness in early spring. In August 2023, CDC launched a new 5-year umbrella cooperative agreement, which I think we reported on when we met during a monthly call, for American Indian, Alaska Native tribal nations and regionally designated tribal organizations. The ultimate goal of this funding is improve public health outcomes and lessen health inequities in Indian country. Recipients received $208,000 each in base funding from our center to improve their capacity to develop, implement, and evaluate public health programs and services in American Indian, Alaska Native communities. In addition, most recipients receive supplemental funding for various projects, including data modernization, injury prevention and control, wastewater surveillance, and addressing cultural competency of healthcare providers serving American Indian and Alaska Native people. The total funding for year 1 is $26 million, and recipients have begun work on these projects. And now I'm happy to turn it back over to you, Deputy Chief Warner.
Thank you, Dr. Dolphin, for this important update. TAC members, we will have further opportunities to discuss this during the upcoming conference calls, but the floor is open for discussion. TAC members attending the meeting virtually, please remember to use the raised hand feature or place questions in the chat box. When you speak, please remember to state your name twice and the area that you represent on the CDC ATSDR TAC to ensure accurate note taking. So I will open the floor for anyone that has any questions or concerns right quick. And like I said, we do have other time later to discuss this as well if you come up with something or your technical advisors. So. All right. Well, moving right along, at this time, I would like to welcome our first presenter for the session on the CDC budget. We are privileged to have Ms. Gallagher to share this update with us. So thank you, Ms. Gallagher, for joining us, and she is the Acting Director of the CDC Office of Appropriations. Welcome.
There we go. I don't know why it would be red to indicate on, but thank you for having me here this morning. As you just heard, I'm Kathy Gallagher. I'm the Acting Director for the Office of Appropriations. My office is responsible for pulling together the President's budget each year and also is responsible for being a liaison with the Appropriations Committee as they consider the President's budget request. Next slide, please. we go. So today I'm going to talk a bit about CDC's budget, including sort of what goes into our role in creating the president's budget. Also, I'll talk some about FY '24, the fiscal year we're in now, and perhaps a little bit about FY '25. I can't say a ton about that currently because as you'll hear why later, the president's budget isn't released yet for the fiscal year '25. We'll get into that some. And then also go into a little bit of detail about some of CDC's awards to tribes. And finally, any questions that you have and some information to connect with us. Next slide, please. And next slide. Thanks. So this slide is just a very high level snapshot of CDC's annual budget. You'll see the last 2 years, fiscal year '22 and '23, as well as what the president's budget is for 2024. And Congress is still considering that budget request. The total amount requested, the total amount we have currently is 9.2 billion. And requested for fiscal year 2024 is 11.7 billion. That's made up of several different funding streams. The first is our budget authority. That's our base appropriation, the resources that are appropriated directly to CDC to carry out the programs that we run. In addition to that, we have prevention and public health funds. Those resources are appropriated to HHS and then further delegated to CDC to run programming. And then finally, we don't currently have any of these funds, but they are requested for FY '24, our public health evaluation transfers. Those are some resources that are transferred within HHS to cover evaluation projects. Next slide. I'm going to spend a little bit more time on this slide. This is a calendar, a somewhat notional calendar of a typical budget cycle. A couple of things to point out here before I go into it. You can note the gray line in the 2024 section around February. That's where we are currently. The green section indicates that we should be executing or spending money that was appropriated for this year. That hasn't happened because Congress hasn't completed their work to appropriate those resources. Instead, what we are able to spend right now is under a continuing resolution, which allows us to spend resources at the same level and for the same activities as were appropriated in fiscal year 2023. So that's what we're continuing with now. So we can continue operations, but can't make new commitments because we're under the regulations of the fiscal year 2023. Congress is still considering the appropriation for 2024, and currently the continuing resolution is slated to end on March 8th. So hopefully by that time we'll have an appropriation. Also note the red section, which indicates when the president's budget is released. And you'll see in 2022, in 2023, that was released in February. That is typical that it's released right after the State of the Union, where the president lays out administration priorities, including those priorities that'll be in the budget. The State of the Union address is not until March 11th this year. And I'm sorry, March 7th, and the president's budget is currently planned to be released on March 11th. So we're just a little bit, I had hoped to be breaking more new news in this presentation, but instead it's similar to what has been in place over the last year. And so, really, the timelines, the process here is consistent in terms of what we do and how we do it. And I'll go into a bit of that. The timelines are definitely not written in stone, and some years are typical, some years are not. Let's see. In the next couple slides, I'm going to talk some more about what that process is. Next slide, please. Yeah. So in April, usually, we receive guidance, we CDC receive guidance from HHS directing us on how to go about thinking about our proposal for the president's budget each year. So this is CDC's opportunity to work with the director, work with our national programs, take into consideration the public health data, the progress of our programs, and a number of other priority areas, and think through what our proposal will be to the secretary for budget initiatives, for increases, for programmatic changes. And we'll pull together a document that is a proposal to the secretary, and we'll make our best case for the proposal that we're putting forward. We do that in accordance with the guidance that they present us. So that guidance can be related to funding levels. It can also be related to policy or programmatic direction. So it varies from year to year. So we might see something that says, in way more words, we'd love to see what you think is important to do, but keep everything level funded. And we have some discretion at that point to think through where we would shift resources with the best of our knowledge and within our priorities to make that case. So we, around June, we'll submit that document, that proposal to HHS for the secretary and HHS leadership to consider. There's a good bit of back and forth between staff in my office and across the agency with the budget staff and HHS. They'll ask clarifying questions. They will push back. They will ask why something is there, why something is not proposed, why we made different changes, that kind of thing. And then the secretary's budget staff will write recommendations for his consideration. In June, June through August, there's a secretary's budget council. At that time, the CDC director, sometimes with additional subject matter experts, will come and present the budget and again, make the best case and answer questions from the secretary and the counselors from HHS. They will take that information and consider it and get back to us with their decisions on our proposal. Sometimes, they never accept everything. We don't get our way completely on everything, but there's an opportunity for them to, for us, when we get their response to our request, to have a little bit more of quick back and forth so we can do some appeal, make some adjustments and see if we can come to a different negotiated agreement with them. And then they'll make their decision. Once HHS makes their decision on the HHS justification, that part of the formulation cycle is over, and we have a sort of a one HHS perspective on what the budget proposal is. Then we start that process over again with the Office of Management and Budget, where we will, working with our HHS colleagues, make the best case for the proposals that were jointly negotiated between CDC and HHS. To OMB, we'll have the same iterative process, questions back and forth from our OMB examiners. They'll make the same kind of recommendation to the director of the Office of Management and Budget, who has the full countries, the full funding to budget to consider with other parameters that they need to work within. Then they will also pass back around the November to January. It used to always be in November, annoyingly right after Thanksgiving. They've gotten away from that some, so it's November to January that we'll get information from the Office of Management and Budget passed back to us. And we have, again, a quick time where we're able to do some appeal and negotiation. And then Office of Management and Budget will make their decision. And that's where we work to create what becomes the president's budget that will be released typically in February, but not always. So this year, hopefully it will be released next month in March. Just a couple of things. I mean, this is kind of a lot of what could be boring step-by-step processy things, but I think the point that is important for folks to realize is that this is an iterative and negotiated process that that we work in partnership up sort of up the chain in the executive branch to come to an agreement, but that once in that everything up to the publication of the president's budget is strictly embargoed. So the only thing you'll ever see, the only thing we'll ever be able to discuss are those final decisions, because that's the administration's policy, budget policy and programmatic policy. The other parts of that are deliberative, and we aren't able to discuss that. So, sorry. Next slide, please. So this slide talks some about the activities that what we do once the president's budget is complete. So it's moving from creating the proposal to promoting the proposal to directly Congress, and then also to folks in the community, to our public health partners, to our currently funded programs to describe what the proposal is. So after the release, we will have lots of meetings with members of Congress and their staff, lots of back and forth with the Appropriations Committee staff. Partners also during this time, which is usually March and April, will be up on the Hill doing their Hill days, doing individual outreach, particularly focused on appropriation members. Then there is typically, or I think always, a secretarial budget hearing before the Appropriations Committee, where the HHS secretary will describe the proposal in a very formal way to the Appropriations Committee. CDC sometimes has a budget hearing, and sometimes we don't. Sometimes they just look to the secretary for that, and then we have the less formal questions, requests for briefings, where we're able to provide additional detail, answer their questions for them to consider what their decisions will be. Typically, the House and Senate mark up their budgets. This means they're coming up with their individual sort of draft appropriation bills and language. And then there's usually by June, this is not really even usually anymore because they really don't make this by June most times, but in the summer, there's a conference where the House and Senate Appropriations Committee will come together. They'll consider the differences in their budget levels and their policy direction in their bills, and come to a decision on what the final bill will be. That again hasn't happened in a timely way in many years. Just a few points on the legislative branch's process. Congress doesn't follow the president's budget. I think at best it is a guideline for them. It's an important statement to Congress, both a budget statement and a policy statement from the administration. But it's not something they take and use as a blueprint, for sure. So they have their own priorities. They have the responsibility to think about the priorities of their constituents. They hear from advocates, and all of that goes into their decision-making on the policy direction and the budget levels for, not just for CDC, but every bill that they consider. So it's important that they hear from you all, and they really do listen. I mean, at this time, as they're deciding, and the good news with pushing off a decision on an appropriation is that there's longer for folks to reach out to their members of Congress to advocate for the public health priorities and programs that are important to you. So the other thing I want to point out, and this is the purpose of, like, why did I get this tiny, tiny list of numbers? I did decide not to try to hurt your eyes by putting this on slides, but this is the operating for CDC's, the operating plan for CDC. The reason I handed it out is because it shows the very detailed level that Congress dictates our budget. So every single line with a dollar amount here indicates a directive from the Appropriation Committee on the amount of money that we need to spend in that programmatic area. So there's very little flexibility in most of these budget lines for CDC to show discretion on where the funding or how the funding will be used. We're really held to, we're definitely held to these amounts, and also guided by the direction that is in the appropriations bill language, which is law, and then also further guided in the appropriations report language, which is sometimes very detailed and very directive guidance on how on congressional intent on how CDC should spend the resources that are appropriated to us. And, you know, I will say the report language is not part of the law, but we do take it extraordinarily seriously because it is congressional. It does show congressional intent. Some of the language is very directive in that it says, we direct CDC to do this in these ways. Others are more suggestive, but we really pay attention to that to make sure that we are carrying out the intent of Congress, which is their role. And then I guess the final thing is, and this is sort of set in stone, is that the new fiscal year starts on October 1st. So whether or not we have an appropriation, the fiscal year starts on October 1st, and we would either be working under a continuing resolution as we are currently, or there have been a few times in recent years where there was a government shutdown, to use the newsy term for it, where we're operating with, we can't operate, but when we don't have an appropriation to operate under. Next slide, please. One more. And this just shows, I've already been over this a little bit, but the total request for FY24 was $11.6 billion. And that is an increase of 2.4 billion over the 2023 enacted level. We also proposed mandatory funding. So mandatory funding, those would be for the Vaccines for Adults program, which is basically $1 billion, and $12 billion over the next 10 years. Also the Vaccines for Children program, $6.2 billion. We have mandatory funding for the World Trade Center Health Program as well as a proposal for mandatory funding for HHY's pandemic preparedness at 6.1 billion. Next slide. And as I've already said, our current status is that we're working the slide, we turned in the slide before the first continuing resolution expired. So it is not February 2nd, it was February 2nd. Now we're under this new continuing resolution, which expires on March 8th. The top line numbers for each of the appropriation bills have already been negotiated. So the appropriation subcommittees have their overall budget numbers to be considering how that's distributed among the various agencies and programs that they're responsible for. And then we are, basically playing a little bit of a waiting game for the budget to the appropriation to be decided, answering still a bunch of questions from the appropriations committee staff as they try to clarify their positions and come to a negotiated settlement. And then again, for the president's budget for fiscal year 25, you'll see that on March 11th. I had hoped to be able to talk more about it today. Next slide, please. The next few slides, I just wanted to talk a little bit more about some of the awards to tribes that we currently have. And you'll hear more about this, or you probably heard more about this yesterday and hear some more about from programs today. The CDC provides funding to tribes, tribal serving organizations, and urban Indian organizations through a variety of cooperative agreements. We have $136 million, more than $106 million awarded to tribes and tribal organizations in 2023. And $3 million, in addition to the 2023 appropriation, an additional $3 million in supplemental appropriations. And the supplemental appropriations are right now primarily resources that we receive to address the COVID pandemic. And so those are monies that are on top of our regular appropriated dollars. Next slide, please. So we fund, in addition to these larger cooperative agreements, we fund tribal organizations through many areas, maybe most areas in CDC. I'm not going to read through each one of these, but this is sort of an example of all of some of the areas that receive or that grant resources out to tribal organizations across the agency. And again, you'll hear from many or have heard from many of these groups already. Next slide, please. So just some examples of the reach of resources in 2023. The Tribal Practices for Wellness in Indian Country, which is $5.3 million, funded 23 tribes and 13 urban Indian organizations. The Tribal Epidemiology Centers, Public Health Infrastructure, had $6.8 million, funding 12 tribal epidemiology centers and 1 network coordinating center. The Tribal Overdose Prevention Program in 2023 provided $11.26 million to 16 recipients, and the Good Health and Wellness in Indian Country program provided $19.3 million to 12 tribes, 4 urban Indian organizations, and 11 tribal organizations. Next slide. It's an example from the Public Infrastructure and Capacity Grant. The Oregon Health Authority's Public Health Division allocated $4 million to 10 recipients from their Public Health Infrastructure Grant Award, including 9 federally recognized tribes, 1 urban Indian organization, and which was the Native American Rehabilitation Association. Next slide. Also, CDC this year launched a new 5-year umbrella cooperative agreement that was launched August 29th. It's to improve tribal public health infrastructure and services to tribal communities and to implement foundational public health capabilities to strengthen assessment, surveillance, public health preparedness and response, policy development, communications, community partnerships, organizational competencies, and accountability and performance management. That grant will also implement data modernization activities to develop and deploy scalable, flexible, sustainable technologies. It will implement public health programs and services to comprehensively meet tribal public health needs and implement workforce activities to develop and maintain a diverse workforce with cross-cutting skills and competency. As of October this year, CDC has provided nearly $26 million to 26 federally recognized tribes and regional tribally designated organizations. Next slide. I think that's my last slide. So you can see how to connect with us through the link there. Also, if you are participating remotely, or if you want to see more information about CDC's budget, our operating plans for, or our president's budgets from past years, you can go to cdc.gov/budget. All of that information is there, or I usually just Google CDC budget and it pops right up as the first thing for more information there. I'm happy to take questions if there's time.
Thank you, Ms. Gallagher. Great presentation. Now I'd like to invite all of our TAC members to share any further questions or comments on the CDC budget presentation. Remember, if you are attending virtually, please use the raise hand feature. And when you speak, remember to state your name and the area you represent. So the floor is open to the TAC delegation. Also a reminder that you can yield your time to your alternate or a technical advisor or a guest. So I will open the floor. Yes, Dr. Sharon Stanfield.
Thank you, Chief. Sharon Stanfield, Chief Health Officer of Governmental Affairs for the Cow Creek Tribe and Rep at Large for the TAC. First question off, thank you for your presentation. As you were going through it, a lot of things were going through my head. And the first is I wanted to ask if the CDC, I'm sure you're aware of President Biden's executive order that came out in December regarding reforming the federal funding and how all the agencies and HHS will do this to promote a new era of tribal self-determination. And so first of all, I just wanted to kind of start with that because this has huge implications. And I sure hope the CDC will be a leader in taking these next steps to help us assure that we fully interpret and follow this executive order. As you're getting ready to prepare your budgets for 2025, tribes are preparing for 2026 right now. But I just wanted to lay that as the groundwork because without that, the rest of what I'm going to say probably, wouldn't make sense. I hear you saying that the line items in your budget are pretty much set. They need legislative changes, which is exactly what needs to happen. So just a few things. I believe according to the OMB, tribes receive about 1% of the CDC budget, less than 1%, 0.7%. We're asking for 10%. We've been asking last September, tribes in the Northwest and across this country are asking for more funds so that we can stand up our own public health departments and not have to go through the state and not have to go through, say, other tribal organizations even or non-tribal organizations. So that's one thing I want to ask is that you be able to work directly with us versus the state. Many of us have compacts and contracts. Would like to see those funds go directly into those agreements. But just really want to make sure that as you design and you look at your budgets, as you're moving forward, that you would remember that this executive order is now in place and that it's to be followed and that we really hope that you will invest in our public health infrastructure and help us be able to do the work we need to do. So I'll stop there.
Thank you, Dr. Stanfield. Anyone else? Second Chief Dale Beaver.
Good morning.
Good morning.
I appreciate your presentation. One of the things that when we create our budget, let me introduce myself. Dale Beaver, Second Chief of the Muskogee Creek Nation out of Oklahoma. One of the things that we do whenever we create our budget is that, we bring all our directors in, our secretaries, and we go over their budget, and then we put our budget together, and then we submit it to our national council for approval. Similar to what y'all do. It seems like we're all similar. But one of the old sayings that we have is to see what matters most to an organization, you look at where they spend all their money at. And for the tribes to be less than 1% of CDC's budget, I'm not saying we have to be 50% of the CDC's budget, but that's kind of how we determine what matters most to us. So with that being said, being less than 0.0%, less than 1% of CDC's budget, how do you determine how much is allocated towards tribes? I mean, what goes into that process? Who are you talking to? What kind of feedback are you looking for? Because it sounds like that, if we're asking for 10% set aside for CDC's budget and we're only getting less than 1%, then there's a disconnect somewhere.
Yeah.
And so I would just like to know, what is the process of who are you bringing to the table that represents the tribes that say, hey, we need more than 0.07%?
I think I can speak to some of the things. I don't know that I'm privy to everything. I think meetings like this are critically important for these decisions. So hearing from you yesterday and today, all of our programs, hearing from you yesterday and today, and in the future is important information for us to have. Similarly, I think, and I'm sure you do this, reaching out to the other decision makers in HHS and OMB, and importantly with Congress. And I think having that layered approach it is really important to give that information. And then we also work once the resources are with CDC. Each program will work to determine how best to reach populations as possible. And sometimes that is through direct funding, some of the grants through direct funding. Sometimes that is through state health departments. And a lot of times that's determined by the amount of resources those individual programs have and the scope of their mission, what they need to accomplish, and getting direction from a variety of areas. And, I think, and then the cooperative agreements that were announced last year and just now are also an opportunity. There are more cross-cutting to provide some flexibility and some additional resources, some higher level of grant resources available to tribal communities. And then
So
I think we'll stop there. I don't know.
So is it just for clarity? Is it our responsibility to make sure our congressional leaders know that there's a barrier here legislatively and that we need to go to our congressional delegates, which is not a problem, and we have a good relationship with our congressional delegates? Or is it the CDC's responsibility to go to bat for us?
I think it's both.
Both.
I think it's both. The constraints that we have sometimes depend on what is in the president's budget. It's our responsibility as part of the executive branch to support the president's budget. We have so we have to sort of carry out and promote what is there. There is some flexibility within some of the directives where we would be able to provide and do provide additional information to them that would inform their their decision-making on direction to us. I always think it's important for individuals and groups to reach out to Congress. It matters. They work for you, for the public, and their responsibility is to represent their constituency, and you're an important constituency of them. And also, again, important for these kinds of meetings broadly with the agency and also with individual programs to continue that conversation.
Yes, Ms. Danforth.
Thank you, Deborah Danforth, Bemidji Area Representative. I'm the TAC alternate for Councilwoman Jennifer Webster for the Oneida Nation. Thank you again for your presentation. I would just like to again echo some of the sentiments that have already been said, and that is, it is extremely frustrating to see that as nations, we're only less than 1% of the CDC's budget, yet we're the population that has the most health disparities and the most underfunding in the entire country. I think, one of our gentlemen that spoke yesterday talked about how the per capita cost for prisoners in the federal prison system is greater than what tribes have for their individual constituents. I think the important thing is that I want to echo is just that I think we've come a long way. Thank you to Dr. Dalton for her leadership here and representing the tribes. But I also think that it's important to note that it took us 20 years to get advance appropriations for IHS. I hope it doesn't take us 20 years to get 10% from the CDC budgets. Thank you.
Thank you.
Thank you, Ms. Danforth. Yes, ma'am. Ms. Russell.
Good morning. Kim Russell, Executive Director for the Navajo Department of Health, representing President Boo Nygren, the President of the Navajo Nation. I had mentioned yesterday that I worked for state government. I worked for state government for almost 10 years. And so I would see the inner workings of how state government received funds, and as tribal people, tribal liaisons of our different agencies, we would see the funds and we knew they weren't going to the tribes. We just knew because we didn't have the influence to make those decisions. Even though their own data says we have the highest health disparities in all the different categories that they're supposed to be addressing, their own state data. So my point is around really, how do you work with the state so that they serve all of the people that they are listing within their grant applications that they are going to serve, right? How do you do that? Because again, being from state government, we weren't in positions of authority to insist on that. Really, it was really up to those state leaders where they wanted to put money. And so when it comes down to when they applied for money through all the different DHHS agencies, they list us in there.
Yeah.
So just maybe some recommendations. A lot of the times we see the funding come out and we're like, where did that funding come from? And how come we're not part of it? We could have used it so desperately. If you could perhaps require, and this is not in your authority, require those states submit a letter indicating that they've consulted with tribes whether or not they would like to be a part of these grant applications. Until there's direct funding, that is one option to address that. And if they are not going to be participating, just at least indicate that they have tried to consult with tribes. And if tribes do want to be a part of that, what is their plan? So a little bit more than just a letter of support, what is really their deliberate actions to work with tribes so that that funding, because it's not coming directly to the tribes, get to the nations. The other thing I want to mention coming from a big tribe is when we get grant funding that's like $300,000-$400,000, it's really not worth it, right? Because we have a big infrastructure to support that. When the funding is so small, we look away because it really will not address the needs that we have. The other issue, and I saw in here in the folder here, about Oregon Health Authority and how that they were willing to share the wealth with some of the tribes in Oregon. So that's a good example of how a state should work with tribes, but that doesn't happen all the time. So my message being within your authority, how do you ensure that states are working with tribes in these areas? And again, you know, you look at their data, it's their own data that they publish every year. And it's going to be American Indian populations that have the highest disparities in these areas, but they're not addressing them the way that they should be. The second thing I wanted to mention was one of your grants, your Strengthening Public Health Systems and Services in Indian Country grants. I applaud you in terms of getting specific funds out to tribes, but that's on a 5-year cycle. And I guess my question is, for those tribes that aren't able to come in this 5-year cycle, when will that open up again? I hope it's not in another 5 years, because now there's 5 years that we cannot be a part of that.
Some of your questions aren't best for me to answer because they're more programmatic, and individual programs who manage those grants provide direction through their funding announcements, and also further direction support with their project from their project officers working directly with grantees and in the communities to provide that direction. On your last question, when would be the opportunity for additional applicants? I think if we were to get additional resources, that would be the next opportunity. And that could happen on a different timeline.
May I request maybe at our next meeting, some of how CDC is going to address really working with tribes? You know, I hate to say it here and then we come back again and it's not being addressed. So Captain Kilsbeck, I'm wondering if that you could do that. You know, what are the efforts that CDC is going to undertake so that at least, you know, at the state pass through, that there is a deliberate effort for states to work with tribes? What is it that you are going to administratively put in place so that when they do apply for these millions of dollars, there's effort to reach out to the tribes within their state? My request. Thank you.
Thank you, Ms. Russell. Dr. Dolphin.
Just thank you for the comments, and especially for the recommendation. Recommendations are really helpful. I appreciate the one about a letter and consultation that when we're engaging on funding, that states or recipients are looking at having a letter, submitting a letter. I don't know how we implement that, but that's something we can certainly look into. And I think yesterday there was a presentation that we have an update on our grants governance board as an internal body where we can discuss things just like this. So I'm not an expert in this area, but regarding specific guidance and language that we can put into our notice of funding opportunities, this might be actually something that we can look at. So I will check. I'm going to accept responsibility for checking into this one and getting back. The second thing I did want to say is about the cycle for our grants and cooperative agreements. Those are constraints that we have. So a 5-year cooperative agreement is a 5-year cooperative. We're actually going to have a presentation by Stacy Madison Jenkins there, who is the director of our Division of Jurisdictional Support, where the tribal cooperative agreement resides and is managed. So you'll hear more about that and where there are opportunities. And certainly these are the kinds of topics we can discuss during our monthly meeting. Thank you. I hope that was helpful.
Ms. Russell, one last
Thank
thing.
you.
I'll get to you, Ms.
Thank you,
Reed.
Chief. So thank you for committing to do that. So again, you know, I work for state government. One of the things that we did recommend to our state government is just this, you know, ensure that when counties apply for grants from state government, that they've at least consulted with tribes. And if they want to be a part of that grant, they indicate how. That didn't go very far. So we could not ensure that at the state level, but because you are the grantor, that's something that you can do. And then of course, you know, I'm looking forward to the presentation, but now that there's 5 years that we're not, if there's any other ways that we can be a part of the work that's happening within those 5-year cooperative agreements, I'd love to talk to you more about that. 5 years is gonna go by again, and then we're 25 years behind, right? We added another 5 years, so, but thank you, thank you.
Ms. Frias.
Yes, thank you. And thank you for your presentation on the budget. Appreciate that. It's always good to know where the money is, right? Or isn't. But one of the things that yesterday we had a couple of good presentations, and one of them was on strengthening tribal sovereignty. And I don't know if you were there or you got to listen to that. But I think one of the important things to know is, the tribes that are compacted and the tribes that are 638. And to understand how important it is for that direct funding.
Yeah.
Because there are opportunities to do direct funding for those tribes. Because we've already gone through those hurdles. And so, we talk about direct funding and we talk about how, states are getting direct funding. And, I know we have a presentation later today with the emergency preparedness. And yesterday we took a tour with emergency preparedness, and we all have talked about how the tribes have done such an amazing job with COVID. And we did. And so the funding can go directly to the tribes, and we have also compacts. So how can we get that direct funding to the tribes that are already practicing this? We have the financial systems and the governance to be able to do this, but we're not doing it when it comes to federal funding, through HHS. So we need to set up that system. We need to set it up. So I just want to reiterate what we've been saying over and over and over again is let's set it up. Let's, with emergency preparedness, skip the state. The tribes have already set up that system and starts, with 638 tribes, with compacted tribes, we have that system set up. Thank you. Thank you.
Dr. Stanfield.
So, Dr. Dolphin, have you guys begun preparing for the executive order? Do you have plans? Because this is a whole new thing. This is something it's like a gateway now. The door's been opened by the president to say, yes, we want you to look at your budgets and assure that tribes are being taken care of. That's how all of this is being solved. Have you guys had the opportunity to start that process? We truly need to be looking at the A19 for legislation, if that's what needs to be done so that these funds can come through. And then I want to make a quick statement about Oregon tribes. That didn't come easily. Tribes stood by for years and watched the counties and the state get funds for public health. And we kept trying to work with our counties, and we kept being told, if they want to share the data with you, they will. If they want to share the funds with you, they will. And we were the biggest partners helping them until finally the tribe said, no more. We need our own funding. So this didn't come easily. Not only did the state provide the money to us pass through, which we'd like to have our own, they gave us extra money. They gave us up and above money. They then asked us, who do you want to work with? And we said, our own health board. Great, we'll contract with them. The state stepped aside. They let us do our own thing. That's why we've been so successful. And whether it's public health money, emergency preparedness, diabetes, every time the state steps aside, they see the tremendous work of 9 tribes and an urban organization that changes the whole Northwest. So I just want to really encourage you as you think about this executive order and you go to prepare your budgets for 2025, 2026, the work that the tribes does helps the entire community, the entire state. And so I think it's got some bigger implications than just tribal nations. So thank you.
Yes, Ms. Russell.
Thank you, Chief Warner. And I think this is probably a greater conversation within the TAC, maybe with National Indian Health Board. I know that we will bring up the executive order and all the different TAC meetings that we have with the HHS, but have we created any aims or goals that we would like the DHHS agencies to maybe work towards? I don't know if we've done that, but because I sit on other TACs as well. And I'm pretty certain we'll have the same conversation. So National Indian Health Board, have we done something like that? We have the order, right? But have we kind of said, this is what we'd like to see by this time? Have we done that collectively?
Not on this tack, but I think that's a next order of business, as these comments and these questions are started to be brought up. So great point. Dr. Dolphin.
I would add also that this is a great opportunity as we are setting our goals because we must be aligned with HHS. And I think I want to thank you for the great presentation and clarifying that when we set forth budget requests, there's this negotiation and the sort of back and forth between CDC and HHS. This is a great opportunity if we are setting goals at this level to do the same at the secretary's level. So for any of you who are engaged on the stack and they are aligning and working on the executive orders and setting specific goals, for us to make sure that ours is aligned there. So I think we have a real opportunity with CDC's TAC and the stack working together at this time. This is the time to do it. So thank you.
Great. Anyone else that hasn't made a comment or a question yet? All right. Well, I will say this. This TAC is making me very proud this morning to be the chair. We're lifting the level of discussion today, and I hope that everyone can hear that and understand. I mean, we've got some meaningful, robust conversation, but that doesn't mean that this is our consultation process. So I want to be mindful of that we continue that. I love the talks about executive order, the mention of the CDC crosscut. I would hope that the CDC would continue and hopefully honor that responsibility to participate within that crosscut. That's something that is very important to this TAC and across Indian country. It's been mentioned here too about tribes and so long can they handle this? Well, it's not an experiment. It was something that we went through, and there was coronavirus relief funds. There was American Rescue Plan funds. So we're coming out on the other side of that. I know our tribe, we've got $1.2 billion worth of capital projects right now to set us up for the next 7 generations to come. We have a joint venture that's been underway for some time that provides close to $120 million a year to operate our clinic in Tahlequah. And we've been able to operate that and those dollars. But as we build out this capacity, I just want to paint a picture for you. And I can do that within the Oklahoma setting. And I want to be inclusive because I know these things are going on all around in other tribal nations and other states. But a study was done in 2019 about an economic impact study of the tribes based in Oklahoma. Northward of $15.65 billion. That's 2019. Look at what we've continued to do today. Now, the Cherokee Nation, just this year alone, over 6,000 students are going to college that are receiving a scholarship from the Cherokee Nation. I know many other tribes do this. $19.5 million. Now, we have close to 12,000 employees across our government and our business arm. So these jobs are we hope that we're educating our next workforce, but also these individuals are going to work in other places. You look at the money that we put when we talk about our car tag money and the money that we put over $7 million into 107 school districts within Northeast Oklahoma. The roads, millions of dollars to go on these roads, the sewer and the water treatment plants, facilities, we're building a new hospital, 127 bed hospital right beside our clinic. We're building a new clinic in Salina. I don't know if anybody knows where Salina is at, but it's a great place to be, those individuals there. But what is public health, folks? I'm trying to paint a picture. I never want to hold harm to the messenger here. Okay, we understand that, but I need you guys to advocate for us because we're advocating that you're doing a great job and what you do. But when I look out and I say, what is that story that I want to tell? Because public health, It protects the individual. It protects the family. It protects the community. It protects that county. It protects that state. It protects that tribe. What I'm trying to paint you a picture of is our tribe believes in raising the tide, and that tide will raise all ships in our area. Native, non-native, beneficiary, non-beneficiary, however you want to define it. We are, in order for us to continue to do what we do, and we're not going to stop building this capacity. If it's up to me, we're going to continue to build that. But we also have to have that help. We also have to have those operational dollars. And I know, like I said, I will not hold the messenger harmful in these situations. When we're talking about working with the state, I've seen times when us and the governor of the state of Oklahoma work very well. I've seen in the present where it's not so well. I'm hopeful for a future, even with that individual still in the office, to make sure, and it was mentioned here, you think about grant opportunities. When we apply, we have to consult the state, but they do not have to consult the tribe. I think that should be on equal ground when you come in there. They should, if they want to apply for a CDC grant or any other governmental agency, they should have to come to the tribe. And I think $15.65 billion is a lot of reasons why. You know, and you look at, we're an employer of choice in our area. So is my brothers and sisters from the Muskogee, my brothers and sisters from the Chickasaw. I could name all the 39 federally recognized tribes in that state. But, you know, I think on the back end of a lot of these things that where we're spending this money responsibly, wisely, we've always been under the microscope. We've always been, people have been critical of what tribal nations can do with dollars. I'll tell you what tribal nations can do. They can help you. They can heal you. They can help you move down the road, whether or not you're a member of our tribe or not. And you just ask the individuals that understand what that means. When we talk about, nobody wants to talk about wastewater infrastructure and water lines. Tribes do. We're going into these places and nobody, there's the county. We're the first place. I know these other tribes have the same situation. We're the first ones that they call when they need help, whether it's a sponsorship for a little girl showing a pig or playing in a sport, or somebody going to Harvard, or somebody doing great things, or hey, what about the namesake of cancer? I'll give you another example. We crossed the state line and Mercy Hospital is building a cancer treatment center in Fort Smith, Arkansas. We were willing to pony up $8 million to go towards that treatment center because we believe in that effort. Now, who's going to get treated there? Anybody and everybody that is willing and able to be able to do this. And that's just one small portion of what we do, because when you take, I would love to see the collective impact across the United States of America of all of our tribal nations and what we do, whether it's economic impact, whether it's public health. But we have to remember, folks, now, most of your life, you're outside of that clinical setting, that healthcare setting. You're out there and you're in that public health space. So we've got to continue in order to do what we do. We've got to protect people. We've got to protect our communities and together. And what I'm doing is I'm asking you to join in with us because we're here to join in with you in this. It's not a fight. It's not a battle. It's just a way of life. You know what you want to call it pragmatic? I say common sense. Common sense says invest in tribes. Tribes will invest in you as well, and vice versa. So that's all I have to say. So, yes, Legislator Barker.
Connie Barker, Tribal Legislator for the Chickasaw Nation. I just really have one comment. You know, from our presentations yesterday, these are federal trust obligations. And so I would like to see tribes be a first thought and not an afterthought. Thank you.
Thank you, Legislator Barker. And I think, folks, we're getting there. And another thing to this TAC and those that are listening, we want this TAC. I'm a competitor. Want this TAC to be the best. We want this TAC to take the lead. Dr. Dolphin, she wants it, and she's been a champion for us. I've heard throughout that she is talking about tribes and for tribes and with tribes, but we need to continue when we talk about elevating this office of OTASA, when we talk about having that director, those visits, these things must continue to happen. We have to have champions for tribes that may or may not be tribal members, because guess what? We're champions of people. We're champions of Gagayu, which means love. We are champions of love, and that is our language. And gosh, I could talk about language all day long because we know how valuable each of our languages are, but we're running. I've taken us right to time, Dr. Dolphin. So get me
That is
fired
great,
up here.
Deputy
And
Chief.
we'll-
Thank you, Deputy Chief.
So at this time, we'll be taking a brief break. And I say brief, we thank you, Ms. Gallagher. I appreciate you so much. Thank you for being here. We'll take a brief break from 10:15 to 10:30. So we'll start back promptly at 10:30. Now, one more thing. We have got the esteemed Dr. Dolphin here. We need to take another photo, okay? So let's mount up there on that stage and let's take a photo. So we'll take a break and we'll return at 10:30.